Good morning.
Morning.
How are you going? You're here to talk to me about breast surgery, is that right?
Yeah, my man boobs.
Your man boobs?
Yeah.
All right, no problem. Look, tell me when you started noticing the problem. And
Yeah, look, probably from my early mid-teens, always just been a little bit heavy set, and just don't like the fact that I actually jiggle when I run.
yeah, fair enough.
Yeah.
Is there something that you can attribute to? Is there something that you can attribute to these getting worse?
They haven't gotten worse. I think I've just decided to do something about it finally. They've always bothered me, always been a bit self-conscious about it. Yeah,
So, I mean, you're certainly not chubby now. Has the weight loss changed them at all?
Yeah, I think when I lost the weight, these didn't go with it.
Yeah, okay.
Yeah.
One of the other potential reasons or causes of enlargement of breast in men are things like hormonal imbalances or problems. Is there anything in your history that might suggest that?
No, don't think so.
You had
Nothing diagnosed.
discharge,
Nothing like
nothing
that.
said. Medications or recreational drugs, that's the other thing that can cause these to get worse.
Okay.
Marijuana, other medications, I know you're pretty fit and well, otherwise
I'll try.
You've got no issues there. All right. In that case, you've got what's called idiopathic or unknown cause, gynecomastia, and these are the commonest. All right. We don't have a specific reason or specific identifiable cause for this to happen. All right. But you're not alone. This is quite a common condition.
Right.
The good news is that surgery can help reduce the breast and the overall look and embarrassment that can come.
Great.
All right. The surgery for this condition is relatively straightforward. It's usually something that can be done in a day surgery setting. It's usually a general anaesthetic, mind you, but the operation itself takes about an hour and a half to perform. All right. Now, the operation itself has two components. All right. Generally speaking, even in fit young men and lean men, there's some fatty tissue containing the breasts. So we remove the fatty tissue with liposuction. All right. That is performed through a couple of small incisions, just underneath the breast. And the other component to it is the actual breast gland, breast tissue. Men have breast tissue just as women have, and it's often the gland component of the breast that gives you the very central puffy sort of look to the breast. All right. The gland tissue is too tough to be removed by liposuction, so we have to do it by excision, essentially. Now, it's removed physically by making a small cut underneath the nipple and removing breast tissue that way. That part of it only takes about 10 minutes to do. And you end up with a very small incision on the bottom part of the areola or nipple area. All the stitches that we use are dissolving, so that you don't have to specifically come back to have the stitches removed. One important part of the aftercare with this sort of surgery is the wearing of a compression vest or a tight garment. Right? It's like a singlet, right? But it's quite a tight compression vest that reduces the risk of bleeding up to the operation. Right? And it's very important that you wear that for a couple of weeks after the surgery. Right? In terms of pain, it's not a particularly painful operation because really all we're doing is operating on the breast and on the skin, I should say, and on the tissue underneath the skin, which actually doesn't have a lot of nerve endings and a lot of thin. So it's not a painful operation as a rule, and I would expect that you would have painkillers for 2 or 3 days after the surgery and not much after that. All right. In fact, you should wake up with no pain because we use a lot of local anaesthetic in that whole area, so that when you wake up from the anaesthetic, you should be comfortable.
Right.
Now, in terms of what happens after the operation, let's have a look at that. About a week after the surgery, we'll come back, have the dressing's changed, have them inspected, make sure there's no immediate problems. And usually at that stage, if there are no issues, we don't see you again until about 6 weeks after the operation. And at that stage, again, provided everything's well, you can see essentially the final result.
Yep.
All right, and you can issue more,
Great.
including exercise, gym, be back at work a few days after the operation.